Hi, I'm Barbara Martin, and I'm here to talk to you tonight about the risk factors and social injustice and economic injustices that are faced by people who are deaf and hard of hearing, as well as deaf-blind. Most of my presentation tonight will be on people who are deaf as a group who are faced often with oppression and lack of access to systems. So in talking about the agency that I'm in practicum, I'm at the Institute for Sustainable Health and Optimal Aging, where we empower older adults to flourish by building collaborative community networks for research, education, innovation, and practice. We're dedicated to bringing about a new vision of aging where individuals who are in society are able to approach age as an opportunity and not so much as a disease or a disparity. So with my knowledge and working practice with people who are deaf and hard of hearing, and knowing that people who are deaf and hard of hearing are in our settings in every single social services aspect of our work. People who are deaf get cancer. People who are deaf are incarcerated or in drug treatment. They may be aging in a facility, in a long-term care facility, or in a hospital, in the legal system, the mental health system, and the list goes on. It's really no different for the hearing population, except for people who are deaf are not given the same level of access. Because they're below the poverty line and they can't pay for services. B, the laws actually cover those aspects and require businesses, both public and private, to provide access. In a minute, I'm going to give you an example of one of the most egregious violations of human rights. So, to begin with, social isolation and alienation from family and peers are identified in evidence-based practices as risk factors for poor mental health, including as much as 4 times higher rates of depression, anxiety, and suicidal ideation in individuals who are deaf, hard of hearing, and deaf-blind compared to those who are hearing. So when you look at economic injustices of people who are deaf or deaf-blind, social isolation leads to a lack of employment, which is reliance upon public assistance programs. Denial of employment occurs. Discrimination on the job occurs. Lack of inclusion in public and employer-based programs, such as even mandatory coaching, planning, peer evaluations, the OSHA trainings that are required in some businesses. Lack of access to communication means those employees don't get the rules unless you give them access to the communication. Oh, but that's too much of a hassle. So let's not bother and let's hire this person over here because we don't have to provide access to communication. So you see where that can happen. So many people who are deaf or deaf-blind are on some sort of an entitlement program such as SSI, SSDI, SNAP, Section 8 housing, Medicare, Medicaid. So here's an example of what can and does happen to able-bodied, intelligent people who are in early adulthood who are denied access to equal opportunity employment opportunities. There's a high risk for turning to criminal activity. Dealing drugs comes to mind because they can't make ends meet any other way. So, hey, let's get into the underground here. So social injustices abound in the deaf population. And although that there were laws established to provide equal access to communications for deaf and deaf-blind and hard of hearing people under the Americans with Disabilities Act, there are specific pieces of the Americans with Disabilities Act that actually specify services for people who are deaf, hard of hearing, and blind and deafblind. So legislative, judicial, and law enforcement wings of the government, here it is, are the largest violators of this law. Deaf people are refused interpreters in police interrogations, court arraignments, and mandatory court-ordered treatment such as group therapy and AA meetings that inmates who are deaf must attend while they're incarcerated. So these deaf inmates attend mandatory meetings but gain no benefit of the therapies that are designed to help them reintegrate back into society upon release from prison. Social injustice is exemplified here. They're arrested without being advised of their rights. They're forced to make inaccurate confessions during interrogations, arraigned without knowing the charges against them, and left out of discussions due to their inability to access the back and forth communications that are needed. Now, let's switch gears to the disparities that occur in the healthcare system. Deaf and deafblind patients have died due to access to communication. So not only are they arrested and sometimes risk being shot during routine traffic stops because they don't hear law enforcement telling them to keep their hands on the wheel or get out of the car and put your hands on the hood, they die in hospital settings because they're unable to provide information related to their healthcare history, or they misunderstand the urgency of their condition and assume an interpreter's on the way. So they don't provide consent to treatment because they don't understand the written documents. It's too complex. It's English language, and American Sign Language is actually recognized as a foreign language. So treatment is, for whatever it's worth, is withheld until consent is given. So I need to tell you that American Sign Language is not a written or spoken language. You have the example of, I went to the hospital yesterday, but a person who uses American Sign Language may say. So as an interpreter for the deaf, I may say to you with that second example, I went to the hospital yesterday, but in reality, what I just signed for sign, was hospital yesterday, me, touch finish. Touch finish means I went there. I touched that place. I experienced that place, or been there, done that. So as you can see, oftentimes in the medical environment, doctors and nurses will say, oh, can you read my lips? Well, lip reading isn't connected to intelligence. It's a skill like art or soccer. So writing notes back and forth is ineffective. And because of that, misdiagnoses and misunderstandings can happen. So often informed families who are well-versed in advocacy must threaten legal action just to get communication for their deaf patients who are relatives. So it's no wonder that anxiety and depression rates are up to 4 times higher for individuals who are deaf and deafblind. Surprisingly, given the role of important healthcare practitioners, both in providing treatment and accessing services, there have been studies with good size mean average, N equals 504, N equals 1,216, etc. So these respondents reported receiving regular support from a general practitioner or a community nurse, but this often happens, they don't get that access because the doctor and medical staff are unable to communicate. So they don't provide the same level of care for individuals who are deaf and deafblind. Furthermore, they deny these individuals their right to access communication through the services of a qualified interpreter, even though they're duty-bound to do so by virtue of the Americans with Disabilities Act. The implications for the development of service provision and practice, particularly with health service, are provided and discussed. So there are anecdotal stories of individuals who attempt to advocate for access on behalf of deaf nursing home residents. And these advocates are actually told they are not welcome back in the facility. Go away, don't bother us. Wow. So there's an alarming area of concern currently being raised regarding the isolation of deaf senior citizens in assisted living and long-term care facilities. Many deaf people placed in these long-term care facilities are effectively placed in isolation. As a result of this isolation, a deaf person will often withdraw. Their language deteriorates rapidly. Their physical presence, body, mind, and spirit just goes on a big crashing curve. Medical services are provided to these people without their opportunity to contribute to their own care, and decisions are made for them. Interestingly enough, nursing homes must be accessible to individuals with disabilities and who are deaf or hard of hearing. This is pursuant to two federal laws. Section 504 of the Rehabilitation Act, 29 U.S.C. Section 794 applies to all nursing homes which receive any federal financial assistance such as Medicare and Medicaid, and require the provision of auxiliary aids to ensure non-discrimination on the basis of disability. So 45 CFR Part 85, obligations under Section 504 have been in place since 1973, and the mandates of Section 504 have been extended to all nursing homes through the Americans with Disabilities Act. But in reality, very few nursing homes make their services accessible for senior citizens who are deaf and use sign language. As we all get older, independence and self-care become issues of concern, and assisted living is a reality for a portion of the aging population in general. Often there's concern about potential for neglect and abuse. Without access to communication for inclusion in facility social programs or the ability to provide proactive input on managing their care, together with the isolation of those who share a common language, deaf seniors often deteriorate at a rapid pace. And there's a strong potential for resignation to a lifelong battle that is born of denial of access to communication throughout their lifespan, where the final act is loss of power in making their own health care decisions at the end of life and dying alone without dignity and respect. So at some point, you have to ask yourself as a social worker, what cultural competencies do I need to have to support a deaf client? Name your setting. Deaf people experience the same things as hearing people. They're in a family resource center at a school, or they're needing access to counseling services in an educational setting. They're in legal settings, medical settings, mental health settings, therapy, long-term care facilities. So my question to you is, how will you advocate on behalf of a deaf client who's experiencing oppression, discrimination, neglect, abuse, violations of human and civil rights? There are remedies for this, but social policy reforms are badly needed. Think about that. Thanks. Good night.